Good afternoon, Mr. Boris. So you were directed to the emergency room because your blood glucose was extremely high and we needed to reduce that immediately. You were suffering from something called hyperglycemic crisis and we gave you insulin as well as normal saline to control your glucose levels and your hydration status. This usually occurs in individuals who have been diagnosed with type 2 diabetes, like yourself, but we can avoid this from happening again and improve your overall health as long as I have your complete cooperation. I know you want to stay around as long as possible to see your daughter grow up. So, can you agree to work with me to improve your health?
Yes, I'll try my best.
All right, sounds good. So, first things first, I can tell that your divorce has you feeling depressed, which is a natural feeling for anyone. I'm going to refer you to a therapist for assessment and weekly sessions to help you cope with any feelings you may have, as well as encourage you to maintain your journey for a healthier you. I know initially it can be difficult to change our natural habits, but we're going to start slow. I'm going to need you to reduce your alcohol consumption to a maximum of 2 beers a day. How does that sound?
Uh, I guess that's not too bad.
Okay, now that we got that out of the way, here's the kicker. In order to improve your health drastically, I'm going to need you to stop smoking cigarettes.
What? I would be inclined to do that, but that's the only thing that calms me down when I'm stressed.
Yes, sir, I understand. But due to the current state of your kidneys, your blood pressure, heart rate, and cholesterol levels, you're looking at a possible kidney failure in the near future requiring dialysis, or you could risk developing some form of heart disease. When it comes to quitting smoking, there's therapy that we can attempt to aid you in quitting to make things a little bit easier. With the help of a therapist and medication to aid you, I believe you can begin your journey to quit smoking as early as today. Is this something that you feel comfortable with?
Okay, but if things get too out of hand, I can't promise that I won't regress back to smoking.
Right. Okay. I understand, but it's really important that you let us know if you do feel the urge to smoke again, because it's not recommended to smoke or to use smoking cessation products and smoke cigarettes at the same time.
Okay, I will make sure to give you or the therapist a call if I feel the need to smoke again.
All right, great. Now we have two big health risks out of the way. Now the rest is pretty much smooth sailing, and just requires you to remember everything that I tell you today. But I'll do my best to be as clear as possible. So our overall goal is to get your blood glucose back to normal, so we can prevent any future issues such as limb amputations, vision loss, fatigue, heart problems, and so on. In order for us to do that, we have to get your blood glucose under control ASAP, and this is what we're going to do. I know how you feel about insulin, but in order to prevent you from having amputations and furthering diabetic complications, you need insulin. If you refuse insulin, you're at a much greater risk of these issues. So, I'm going to start you off with 13 units of insulin glargine after dinner. As far as diabetic medication you're responsible for taking by mouth, we're going to reduce the dose of your metformin to 500 milligrams twice a day and discontinue your Farxiga, canagliflozin, and Victoza due to the current state of your kidneys right now. We're going to schedule an appointment for 2 weeks from now, and you should let us know if you experience a drop in blood glucose below 70 or your blood glucose spikes over 200 at any point. If blood glucose levels fall below 70, make sure you drink some fruit juice or eat something small and sweet like a peppermint. So, can you repeat back to me what your regimen will be so far?
Yes, I will be taking 13 units of insulin every night after dinner, and I will continue to take my metformin as usual.
Correct, yes. Now, our A1C goal that we're going to try to work towards is 7%, and we want your fasting glucose to be below 140, as well as your glucose levels after eating should be less than 180. Please continue to diet and exercise like you did when you initially lost 31 pounds, but I want to add to that regimen a low sodium diet. When you're eating food, make sure you pay close attention to the food labels and keep track of the amount of sodium that you're having per day, ensuring that you don't go past that daily amount. As far as antihypertensive medication, we're going to start you on amlodipine and benazepril every morning. In order to control your cholesterol levels, we're going to initiate atorvastatin 40 milligrams every night before bed. And if you feel any muscle pain, such as back pain or arm pain, leg pain, let us know immediately. Also, when getting up from lying or sitting positions, make sure you get up slowly. Lastly, it looks like you're taking medication to help with your seizures. The levels of your phenytoin medication for your seizures are a concern, so we're going to need to adjust your dose. But as of right now, do you have any questions about your new therapy?
Do you promise that placing me on insulin won't add on to the problems that my diabetes already is causing me?
No, sir. Or, yes, sir. I promise that adding insulin onto your therapy will not cause you to have additional problems. Actually, it should be helping you. In fact, if you follow my directions properly, you could be off of insulin in less than a year. Now, can you repeat back to me your overall new drug regimen?
Yes, I will be taking my blood pressure medication and my first metformin pill in the morning. After that, I will take my 13 units of insulin at dinner time. Then I will take my metformin and atorvastatin after dinner and before bed.
Yes, sir. It sounds like you have everything under control. I'm going to schedule an appointment for you to see me in 2 weeks to assess your kidney function and fasting glucose levels. Have a great day and do not hesitate to call me.
Thank you so much. I will see you in 2 weeks.
Alrighty, Mr. Boris. Have a great day.